The health and safety of Florida residents stands to be impacted by broad cuts to everything from food safety to climate readiness programs. Here to talk about it, I am joined by Dr. Jeffrey Goldhagen, chair of the Department of Pediatrics at the UF College of Medicine, the former director of the local health department. Good
Good morning.
morning.
Good morning.
We're also joined by Dr. Mobeen Rathore, associate chair of the uh, University of Florida's Health Jacksonville, also the same school, the College of Medicine. Sorry about that, Dr.
All right.
Rathore. Welcome so much.
Thank
Glad to
you.
have you.
Thank you.
We're also joined via video by Norín Dollard. She's a senior policy analyst and Kids Count director at the Florida Policy Institute. Good morning.
Good morning.
So there are wide-ranging cuts that are being proposed across the spectrum, programs that deal with health and research and well-being. Dr. Goldhagen, what are you most concerned about?
Well, mostly I'm concerned about the assault on science and the assault on institutions. So all of the specific programs that we'll be talking about today are part of institutions and are built on the foundation and framework of science and universities and, frankly, decades of experience and research that have come before. And so what we're seeing is the entire foundation and infrastructure of what we've come to rely on being decimated. And the issue is that we will not be able to put it back together. It's sort of like Humpty Dumpty. And so the longer that this assault and this dismantling of institutions and science continues, the longer and more difficult it will be to actually put it back together again.
Is science unique in that respect? Because we're seeing a lot of agencies that are seeing massive cuts and are being, seeing firings, seeing defundings. Is there anything unique about the world of scientific research or science itself that makes it more difficult to the prospect of rebuilding?
Well, everything that we're looking at, whether it's dismantling the Centers for Disease Control, dismantling NOAA, dismantling the EPA, all of that work is based on years and years of science and research, and those institutions are the strength of those institutions is built on what has come before. And all of those individuals, all of that science, all of that evidence base, all of those institutions are just being dismantled. People are being fired, as you said. They're not coming back to these institutions again. So what we have spent decades and decades building, what has made America great, is now being dismantled in front of our eyes. And again, whether it's predicting hurricanes or addressing the measles outbreak or dealing with housing, whatever issue that you identify, what we've done is dismantled the foundation and infrastructure of those programs and those institutions, and all of that is built over the years in science and research.
So, Dr. Rathore, how about the world of research? I mean, Dr. Goldhagen is talking about that. There are certain data sets that have been removed or become less available. There are studies that are ongoing that are going to take a break of some kind, and information that might have been collected in that period could be lost. Can you explain to people, in the world of research, particularly why that is significant?
So as Jeff mentioned, there are infrastructures that have been built. There are teams that have been built. It's not like in the past. We don't have Alexander Flemings and Jonas Salk, individuals who are doing the research and getting results. Now it's teams, these teams we have taken time to build them. Decades. Myself, we have been doing our research here in Jacksonville for more than 30 years, and we have built those teams. And once you start losing the funding, the teams are going to dismantle. And it's not like me as a physician going in and taking care of the patients day one. You have to build these teams. Everybody has a role in that. And what this has done is, for research, for example, if we have had two of my three NIH grants, we don't have the notice of award. We don't know if they're going to get funded or not. So what does that do? Everybody knows that. So the team people, the staff, the coordinators, the groups, they are concerned. It's also people's livelihoods. They have bills to pay and kids to take care of. So people are leaving, or fortunately I had not had to let go anybody, but people see the writing on the wall and they're leaving. It took us 30 years, 31 years to build this, and there are people who have been doing this for 40, 50 years. Once you break that, it's extremely difficult to just put it together again. As I said, as Humpty Dumpty, even if you could put Humpty Dumpty together, it's going to take many years.
And you talk about a notice of award. That's something that in the research cycle, you kind of wait to make sure that the money is in place. This has already impacted you in the work that you do?
Absolutely. The funding, where it happens, is all federal funding, not just NIH. You get a notice of award of that funding that goes to the university. The federal government says, hey, we're going to give you this money. And the university says, okay, your credit is good. University advances money and we do our work. Well, if they don't get the notice of award, university doesn't have any money to advance. So I think that's a huge problem. And I think it's going to impact. We talked about CDC. The CDC impact you're going to see sooner, unfortunately. We're already seeing it. 600 cases almost of measles in Texas. And I've got news for you. That's not the worst of it. Think about another Ebola. Think about another COVID-19. You're not going to have time to build that devastated infrastructure. We've already seen it in Florida. The health department has been devastated over decades. It's very difficult to bring it together. CDC is one of the most respected organizations globally. I mean, people are coming from international conferences, and our colleagues world over are very concerned about not only the United States, because many of them are following CDC guidelines.
And so this, you're saying that the impact of CDC cuts is something that we will see and experience faster than we might the cuts to research and agencies like NIH.
Well, the CDC cuts, I hope I'm wrong, but there's going to be just one flight from somebody from some other part of the world bringing in a disease that we have very little knowledge about, where the community of physicians and healthcare workers don't know enough about, and we will not have an organization that's going to guide us to do that. That's what I'm most concerned about. The research part is being devastated, but those results you're going to see 10 years, 5 years down the road. The research is built on small parts which are then brought together, and we have a result. Just remember, for HIV, I've lived HIV care in all my professional life. In 91, we had nothing. In 96, we could treat HIV with a cocktail. And now we're talking about one shot every 6 months, perhaps, for HIV-infected patients. That did not happen by chance or on its own. It took hundreds of people, teams of people working together to be able to build that. These are all interconnected. What the NIH does, what the CDC does, how the FDA gets involved in that. And here's another thing that I'm very concerned about. There is now attack on Ryan White funding. Ryan White funding forms the basis of the infrastructure for healthcare of HIV-infected individuals and families. And the fact that we are in Jacksonville, we have decreased the transmission of HIV infection from mother to babies from 25% to almost zero. That is because of research. We participate with the NIH. That is because the FDA approved the drugs. That is because CDC came up with guidelines, and all of that can now be implemented through Ryan White funding.
And it's important to also recognize that it's not just infectious diseases. So in the front page of the New York Times this past weekend, there's a major issue with lead in the schools in Milwaukee. And they're looking to the Centers for Disease Control for help, support, how to mitigate, how to intervene, how to prevent. And there's no lead program anymore
and no
at
one
the
to
CDC.
call. I think the guy in the article was saying there's no bad phone. There's nobody to pick up the phone and say, I need help in Milwaukee.
Absolutely. So it's not just infectious diseases, although bird flu is knocking on the door at this point. But it's things as like lead and other critical issues that are impacting communities, and that's our children. It's not, when you ask the question, is this in the future? It's today that's happening today.
And to Jeff's point, I think many people, not just those of us in academics, count on that number, which is listed. You can pick that phone, call that number and say, I have this issue. And somebody at CDC will answer that call and get back to you very quickly. In 92, I don't know if Jeff was the director of the health department, when we had the measles outbreak, it was a pediatrician in this community who picked up the phone and called Jeff's department and say, hey, I'm seeing measles. We all got involved. The CDC got involved. And, we had a lot of cases, but we mitigated it. in this community because of the efforts of all these different groups.
Yeah, and we know that some of those cuts that are impacting are people that were assigned to work on the measles outbreak in Texas. Those are people that have been scaled back in these cuts. I want to bring in Norín Dollard, though, if I can. The Florida Policy Institute has looked at some of these cuts. What is the agency? I mean, you oversee the Kids Count program there specifically. What are your what's your research showing about what these impacts could be for children in particular?
Yes, thank you. We are very concerned about what is happening at the federal level. There are proposals to that would substantially cut Medicaid, and for one, which is publicly funded health insurance and covers nearly 40% of Florida's children. So a substantial proportion. And why health insurance is important is that it confers benefits to kids over their lifetime, and not just the expected health outcomes, but also in terms of their educational outcomes and economic outcomes. So to take away this safety net from them is just insane. To take this safety net away, we have a very high uninsured rate of for children as well. We're ranked at 47th of the 50 states, and it's a huge number of children. Statewide, we're talking about 4.2 million Floridians, including 2.1 million children. So it's really a substantial proportion.
And we should be clear. I mean, the cuts that you're talking about are largely what we're looking at in this 2025 proposed budget that call for $2 trillion in mandatory spending cuts from areas that include Medicare and Medicaid services.
That's right, the Centers for Medicaid and Medicare Services. And there has been a concurrent budget resolution passed about a week or so ago, and the House was instructed to reduce the federal deficit. It's a little confusing. The Senate's language is not the same, so there will be some negotiation about exactly what will transpire. They're preparing for a budget, what they call a budget reconciliation process, which would implement these cuts. And there should be opportunities to expand Medicaid. When you look at polling, Floridians are very invested in having health insurance and actually expanding Medicaid to young adults without health insurance that fall into the gap where they're not covered by what is known as Obamacare, Marketplace, or they're not eligible for Medicaid because they make just a little too much money, but their employers don't cover. And that's more than another million Floridians that expansion would support, and we're one of only 9 states that has not taken advantage of Medicaid expansion.
Mm-hmm.
And it's, of course, the health benefits are very important, but there's huge economic benefits as well because of expansion would bring new jobs. There's a huge increase, like $44 billion in economic growth. So in essence, this program really kind of pays for itself if it were to be expanded. So it is a big boon. It would be a boon to our economy.
If you're just joining us, we were talking about the potential impacts of massive cuts to federal health, safety, and research programs. If you have thoughts about the cuts, you can join the conversation at 904-549-2937. You can email firstcoastconnect@wjct.org or reach out on social media. I want to shift gears just to talk a little bit about climate preparedness, because we know that one of the impacts of these proposed cuts is NOAA. These are cuts that are coming less than 2 months before the start of the 2025 hurricane season. These are cuts that are supposed to take place immediately. as much as 27% of NOAA's budget cut immediately. Dr. Goldhagen, what would the concern there be, particularly for Florida?
Well, so the cuts to NOAA and research and so on related to climate change will have a devastating effect, not only in our preparation, but also, and interestingly enough, also on the capacity of our farmers to actually predict what the weather is, to know what the weather is going to be. So on the surface, it looks as if these cuts are primarily going to have an outcome related to our preparedness and ability to respond to hurricanes and other events. But it's also deeper than that. So that whether it's agriculture or issues related to wildfires and other climate-related concerns, we've lost our capacity to monitor them and to respond to them. And we in Florida obviously will be significantly impacted. And it's not just the institutions, but also the science that universities and so on and so forth that are funded to study these issues, climate issues, that are being defunded as well.
And these are all interrelated things. I think that's the thing. One part, Medicaid cuts affects what? You have a hurricane, and then all these children and people who have no insurance, they get injured, they have infections, they have other diseases, they go to the hospital. How are the hospitals going to afford? They'll have to take care of the uninsured. And children's hospitals, I don't speak for children's hospital, but children's hospitals have a very high percent of Medicaid population. And they also take care of everyone. So this is going to have a significant impact on that part of, as I said, all these things are important on their own, but when you talk about interrelatedness of these things, then it's exponential problems.
Dr. Goldhagen mentioned the impact on research, and people maybe don't understand just how much of the nation's research, how much of NIH's research dollars go to schools that do that kind of research and sort of the rationale behind that. Maybe you can explain a little bit about the impact on schools and kind of why it's designed that way.
So I think any funding that we get from NIH, from the federal government, the institutions get what they call the indirect costs, which is started with Dr. Jonah Salk and March of Dimes. He was the first investigator who got indirect costs, and that helped build the infrastructure. And that's very important. Now, I would say that there's perhaps opportunity to look at that part, what percentage should be, all of those things. I'm not an economist, but I think that is something that can be looked at. But what is spent directly on research, so for every $100 I get for research from NIH, University of Florida gets $52. So that helps them to have the IRB, that helps them to have all the other things. That doesn't help it directly, but indirectly helps. So I think you can look at everything. You can look at the efficiency, the cost. I'm okay with that. All of us should be okay with that there's no wastage. But to just cut it outright and stop it makes absolutely no sense. It's dangerous. It's dangerous to the population. It's dangerous to you, to me, to Jeff, to Norín, because we have children, grandchildren, ourselves. What's coming next? Certainly you won't have the resources to take care of even the elderly, because they are going to be impacted.
Don't look at me when you say elderly.
Norín Dollard, in terms of SNAP benefits, that's also something that is at risk. How does that impact the picture for, women who are expecting a child or families with small children?
So the Supplemental Nutrition Assistance Program, or SNAP, what we used to call food stamps, has a huge great benefit on Florida's children and families. Children need proper nutrition for brain development, so they're able to, live really thrive and live up to their potential. And their mothers, of course, need nutrition, during pregnancy. And SNAP actually has been shown to have positive effects on maternal mental health. And so Dr. Rathore said all of these things are interrelated. the climate, child nutrition, and their ability to really grow and thrive. Unfortunately, in our state, we have nearly 3 million Floridians who are food insecure. So that's like 1 in 5, and 1 in 5 kids. In Duval County alone, there's more than 125,000 residents who are considered food insecure, including 23% of their children. SNAP is, Dr. Rathore was talking about efficiencies, and SNAP has been shown to be one of the most efficient programs that federal programs, and it's largely funded through the federal government. The state does contribute, and what they call the administrative share. So the food gets to the people who need it, but the federal government is the one who pays for nutritional benefits, the U.S. Department of Agriculture. And that also, relates to Florida's farmers, because not only does SNAP have benefit to the recipients of the nutrition assistance, but those folks spend money in the economy using their assistance, and and so there's farmers who are positively affected because there is nutritional support going to Florida's families. There are huge anti-poverty benefits that are conferred through SNAP. It benefits veterans. 7% of Florida's veterans receive SNAP. So there's many important benefits for Florida. And the thing that the threat, as it is known, and these things do change sometimes minute to minute, but the most recent proposals include introducing a cost share to Florida, meaning that the state's legislature would have to appropriate dollars, so either 5, 10, 25%. All of these numbers have been floated. So we would have to account for that in our state budget. And as you all know, it is the legislative session is going on right now for another few weeks, and I spend a lot of time paying attention to what happens in the legislature, and I've heard no conversation about the state preparing to pick up any shortfalls that could happen from the federal budget process.
Dr. Goldhagen, I mean, there's so many, topics that are interwoven here, but it is hard, I think, for people to get their head around so many disparate issues. I mean, what would you drive home for people who are trying to digest the impact of these cuts and how to think about them?
Well, it's particularly important that people understand that their day-to-day life is going to be affected by these cuts. The main focus now is on the cost of food in our grocery stores and the tariffs. But when we look at the entire community that depends on mental health services, those are being cut. Communities that rely on housing support and affordable housing, those are being cut. The community of people on the autism spectrum have now really revolted by what we heard Kennedy say about autism. Their lives are going to be impacted. What I think reaches a status of diabolical is in our state where child labor laws are being changed to allow 14-year-olds to work overnight to be able to replace the deported migrants. I mean, those issues. So whatever part of your life every part of all of our lives are going to be impacted. And I would ask people just to pay attention to those impacts that they're experiencing on a daily basis. Medicaid, as an example, less than 50% of the dollars for Medicaid go to cover insurance. The bulk of Medicaid dollars go to cover a nursing home care for low-income people and even high-income people who spend their resources down. So nursing home care is going to be impacted as an example.
Yeah. And we didn't even get to food safety, but we are going to have to leave it there. Dr. Jeffrey Goldhagen, Dr. Mobeen Rathore, and Dr. Norín Dollard, thank you all so much for being here. I really appreciate it.
Thank you.
Thank you.